the congestive heart failure. And everybody have heard about congestive heart failure, or you have had somebody or know somebody that has congestive heart failure. So what is this congestive heart failure? Is it something that is really high risk and high yield in the exam? So congestive heart failure is the heart inability to pump enough blood to meet the body's need. So somebody's heart is not able to maintain or not able to pump enough blood to maintain the needs of the body. So it will lead to fluid overload, it will lead to poor perfusion, and it will lead to progressive organ dysfunction. And like I said, this is anatomy. That is not where your question will be coming up from. Okay. But one thing is that you need to know that it's just a quick review I'm doing. CHF is that inability of the heart to pump enough blood to meet the body's need. So when the heart is not pumping enough, like the pumping system is so low, it will now lead to fluid overload, poor perfusion, and progressive organ dysfunction. We have types of heart failure, but I'm just going to focus on the two because we have the four. And some of us don't understand some of those things, like they put heart failure, reduce ejection fraction, preserved or preserved ejection fraction. Sometimes it's so confusing. But for the emphasis and for the purpose of the exam, I'm just focusing on these two, and which are the two is the right-sided heart failure and the left-sided heart failure. But we have four types of heart failures. The HFrEF, which is reduced ejection fraction, systolic. It has to do with the systolic dysfunction. Then you have the diastolic dysfunction, which is the HFpEF, preserved ejection fraction. But by the way, just for your knowledge. Then one thing about congestive heart failure for the exam you should also need to know is that patient always present with a weight gain. Like when they tell you, for example, a patient presents maybe 10 pounds in a month, that is a lot of weight gain. And patient presents with a S3 heart sound. S3 heart sound, that is a buzzword. S3 heart sound. Another thing about congestive heart failure is that when they do the chest x-ray, just know this diagnostic test is very important for the exam. The chest x-ray, you are going to see what we call KB lines, and you also have this EKG. They can do EKG, they can do CPK, they can do troponin, but don't forget BMP. Some of you have been seeing this in labs and you ask yourself, oh, what is BMP? BMP, beta type natriuretic peptide. That is what you always see. Whenever it's elevated, there's any chances that patient have a congestive heart failure. Then another question they can ask is the what over the counter medication. And that is why I keep saying it. Ibuprofen, NSAID is not something that people should be just taking randomly because they feel like, because it's over the counter. Okay, they only need to take it when it's necessary, because NSAID, which is your ibuprofen, can worsen heart failure. It can worsen heart failure. So many things we are getting over the counter. We have seen it, including cough medicine, antihistamine, the congestant. Sometimes some of those things are not really helping. It will help to relieve the symptom, but it can have a lot of other medication interactions. So they can also ask you what diabetic medication worsens heart failure, and that is your TZDs. We call it actose, TZDs and actose. Then What blood pressure medication worsens heart failure? Calcium channel blocker. These three things and these 3 points that I mentioned always high yield in the exam. Which over the counter medication worsens heart failure? Ibuprofen and NSAID. What diabetic medication worsens heart failure? TZDs, or also known as Actos. Then which blood pressure medication worsens heart failure? Calcium channel blocker. Calcium channel blocker. And this is also for emphasis. Then another important thing you need to know, when we are treating heart failure, we use diuretics. But two things you must know about the diuretics we use. Some of us don't know the difference. We have thiazide diuretics and we have loop diuretics. As example of thiazide diuretics is your hydrochlorothiazide, which is always commonly used. But know that hydrochlorothiazide is used for mild heart failure. Mild. Then, if somebody have a severe, remember those fluid overload, you want to get those fluid out of the body, and is a severe case, then you are going to use loop diuretics. An example of loop diuretics is your Lexis, also known as Bumex. And I also mentioned the diagnostic test, which is the BNP. Anytime is greater than 500 is indicate heart failure. So what else do we need to know? They can do BMP, chest X-ray because of the pulmonary congestion. They can do echocardiogram to measure those EF measurements. They can also do ECG. We have mentioned all those things. Then another important thing to always remember about congestive heart failure is the symptoms. So what are the symptoms? You have to look at what type. So we say that we are focusing more on the right and the left. So when patient presents with right-sided heart failure, right-sided heart failure is also known as copulmonale. Copulmonale. And this patient is going to have what I call it GI symptoms, gastrointestinal symptoms, plus peripheral edema, plus JVD. So that means they have gastrointestinal symptoms. For example, they will have like nausea, vomiting, enlarged spleen. Those are GI, enlarged liver, anorexia, nausea, abdominal pain. Those are your GI. Then they are going to have peripheral edema. Their lower extremities will be swollen. Then they are going to have JVD. JVD is jugular vein distension. So if they tell you that patient presents with jugular vein distension, what type of heart failure is that? That is your right-sided heart failure. They have the GI symptoms, they have the peripheral edema, and they have the jugular vein distension. Then we have another type of congestive heart failure. So this is the right-sided. So which is what I have already said. It's also called the copulmonale. This word here, COR, copulmonale. Okay. Then it's they have the jugular vein dissection, hepatomegaly, splenomegaly, ascites. Ascites is peritoneal edema. Everywhere is swollen. Then anasaka. Anasaka is the full body edema. Then they have the S3 heart sound. I've also mentioned what blood diabetic medication worsen heart failure. TZD. This is the medication that is TZD. Thiazolidinone. Thiazolidinones. Okay, whatever you can call it, is also known as Actos. They are the diabetic medications that, and sometimes you need to know another name. It's like poclitazone. And the way they ask these questions in the exam, they can present a patient that is on maybe like 5 medications, for example, 5 medications, and they will ask you which of these medication, and patient have a history of heart failure, and patient is diabetic, and they ask you which of the following medication should be avoided, then the answer is pioglitazone, because that is under thiazolidine, thiazolidinones, okay, which is your TZDs, your actose. Okay. What are common in both the right and the left? Both of them have S3 has sound. Both of them are worsened by NSAID, TZDs. BMP will be elevated, KB line, and both of them will you use diuretics. And I said if it's mild, you use um, thiazide. If it is severe, you use your furosemide. So the next one is your left-sided heart failure. So what is happening in left-sided heart failure? Anything that is happening at the lungs, that is your left-sided heart failure. Anything that is happening at the left side. So your left-sided, it always has to do with anything happening at the left side, which is the lungs. Anything happening at the lungs. So remember, left lungs. So patient is going to have crackle, cough, dyspnea. So anything that has to do with the lungs. So that will be your left-sided. That will be your left-sided. Then another important thing for the exam is the classification. And these are the two classifications for heart failure. These two bodies, they broke down the symptoms of heart failure for you to know what stage or what class of heart failure they have. This person have congestive heart failure, but is it like class 1, class 2, stage 1, stage 2? You should be able to know. So the first one is the American Heart Association. So American Heart Association, they used according to the structure. So what they said is that if a patient have high risk, so for example, if a patient have high risk, what is the high risk? If somebody have diabetes, hypertension, is a high risk, okay? But no structural heart issues. No structural heart issues. So somebody have a high risk, but no structural heart issue. So what does that mean? Patient have hypertension, patient have diabetes, but they don't have any problem with their heart. They don't have any heart problem like cardiomegaly, ventricular hypertrophy, any of these heart problem you can mention, they don't have it. So that is, you will group them under A. Then you have another people which is B. They have structural heart problem now. So this person that have hypertension over the years or diabetes over the years has resulted to complications in their heart, and they start having ventricular hypertrophy. For example, somebody that have had hypertension over the years, there is always chances that they can develop cardiomegaly, ventricular hypertrophy. But this person do not have any symptom. They are not showing you any symptom like shortness of breath, fatigue, pallor, cyanosis. They are not showing you any of those symptoms. That is stage B. But stage C is that they begin to have those symptoms now. They are beginning to have those symptoms. So that is 3, or B or C, sorry. Then the fourth one is that you are going to refer them. But we have another group which is the New York Association. So New York Association is dealing with the symptom, the symptom. So they broke their own down and said if patient with no symptom. Patient have heart failure, but they don't have any symptom. There's a lot of patients that have heart failure, but they don't have symptom. That is stage one. But stage two is that if they start having symptoms with significant exertion. So let's say patient has to do with activity. Patient is taking a walk. Patient is running. For example, most common thing patient will mention is that I was climbing my 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 staircase and I start having shortness of breath. That is a significant exertion. They are climbing a staircase, they are taking a walk, they are jogging, they are dancing. That is stage two. Stage three is when patient begin to have symptoms with minor exertion, things that shouldn't be an issue. They are not really doing a lot. Let's say you are telling a patient to eat. Eating Eating is not too much exertion. Tying their shoe is not too much exertion. Changing their position is not too much exertion, but patient begin to have symptoms. Then stage four, which is the worst, even when patient is at rest, patient is lying down on the bed, patient is sitting on the couch, and patient is still having shortness of breath. This kind of patient that is on stage three and stage four, you will always see them on continuous oxygen. They are always on continuous oxygen. Sometimes somebody on stage three, sometimes they use it with activity. Let's say if it's always happening when they are eating or something, uh, because it's with a minor exertion. But for people that have stage four, stage four must have oxygen, to be honest, because even at rest they are having it. So these are the kind of way they can ask you the question. Which of the following best describe the patient presentation of New York stage 3? So if you remember what we stage 3, which is New York. So stage 3 with moderate symptoms. They have moderate symptoms with less than normal physical activity, less than normal. So that means less than normal. Let's say they are tying their shoe. So less than normal. So the answer is C, less than normal. But if ordinary physical activity does not cause any fatigue of pain, this is one. It does not. One. B, ordinary physical activity result in this is two, because ordinary physical activity like walking, jogging, dancing, that is two. Then less than ordinary, which is minor. Okay. Then discomfort increases with physical activity. This is also two. We have an okay. So I think that answers. Okay, this is another one. Which of the following best describe the patient presentation of New York Heart Association stage two? Stage two. So in stage two now we have mentioned it. That means that ordinary physical activities is going to cause them. So stage two, ordinary physical activity is going to cause them fatigue, palpitations, dyspnea, or angina. Any